everyone, and welcome. I'm Martha from Dental Brush-Ups, and today I have a very special treat for you guys. Today, joining us is one of our inspirational professionals named Professor Linda Douglas. And Ms. Douglas has graduated since 1982 as a dental hygienist from the Royal Dental Hospital in London, England. And in 2013, she graduated from O'Hare University with a Bachelor of Science degree in Oral Health Promotion. Professor Douglas has worked in clinical practice in Toronto since 1990. She is also the clinic director for Hygiene Town, a supportive online community and publication for dental hygienists. She works as an instructor at O'Hare University and is also a manager for a new LinkedIn group called Today's Women in Dentistry. Linda has published many research articles, including in the BDJ Team, which is a British dental journal publication, Dentistry IQ, the International Dental Tribune, and Hygiene Town magazine. She has presented at the annual Townie meeting, the Toronto Academy of Dentistry Winter Clinic, and the Caribbean Dental Program in Barbados, in addition to various study clubs and dental societies in Ontario. Linda's desire to help anxious patients has instigated in-depth study of the issues faced by survivors of childhood trauma and other individuals with dental phobia. Linda also writes and speaks on xerostomia management, saliva testing, and caring for dental patients with eating disorders. Thank you, Linda, for joining us today. So, Linda, tell us a little bit about yourself.
So you've told us quite a lot, but yes, I've been practicing for a long time, and I still have quite a passion for it. And my presentation, I'm going to show you a little synopsis of today. It was actually inspired because I had met so many nervous patients, and some of them, their nervousness comes out in other ways, so they can appear to be quite aggressive or rude when in fact they're terrified. So this was something that I've investigated for most of my career.
Wow, it's true leadership. That's amazing. And Linda, can you just walk us through your journey in education a little bit?
Actually, soon after I graduated hygiene school, I was invited to become an instructor because I guess I was very studious, but I was very shy, and I said, I'm not ready yet. And also, because I was so shy, I actually had a disastrous first experience at presenting, and my voice was so shaky and I was terrified, and I ran through the whole thing without drawing breath. And so I decided I will never do public speaking ever again. But after I studied with O'Hare University, Tricia O'Hare gave me that little push to share a presentation at the Townie meeting, and I really enjoyed it, and I've been doing that ever since. I realized that before I used to think that it was innate to have that ability to speak in public confidently, but it's something that you can learn. So I finally came out of my shell, and now I'm an instructor with O'Hare University also, because most hygienists actually graduate from hygiene school with almost enough credits for a master's degree, and unfortunately only get a diploma or an associate's degree. So this was the reason Tricia founded O'Hare University, to give every hygienist the opportunity to attain their Bachelor of Science degree.
Oh, amazing. So Linda, can you tell us a little bit about your most recent projects?
So Most recently, I haven't done much with it yet, but I've become increasingly interested in issues concerning tongue posture and and disordered breathing and the ways to breathe properly, and the benefits of nitric oxide. So that's ongoing. I actually, one day I decided to just search with two keywords for research: exercise and periodontal disease. And I actually found some research studies that showed that exercise actually benefits the periodontal tissues. It
Mm-hmm.
reduces the inflammatory markers. So I thought that was really fascinating. And also diet. Sugar is responsible for so many of our health problems, and we've always been educated about sugar and caries, but sugar plays a major role in inflammation also.
Absolutely. And now you create presentations for those patients, and I guess for treating patients with dental anxiety and dental phobia as well. So
That's right.
that's actually, that's really good. That's amazing. I think that there should be a lot more awareness about that out there, especially nowadays with all this stuff going on with the virus, correct?
Yes, yes, indeed.
Mhm.
And actually, a lot of dental professionals are quite anxious too. The good thing is that we were afraid that when patients see us suited up, that they'd be really scared, but they're actually quite reassured to see us wearing the PPE.
Mhm. 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 So, would you like to show us a little bit about your project on understanding patients with dental anxiety and dental phobia?
Cer- Certainly. So, so as I said, this is a topic that's always interested me, and so it part of it was instigated because you've probably seen those people expressing on social media their frustration with patients who refuse to lay back in the chair, who don't take care of their teeth, although their manual dexterity is good. And so I read some literature on patients with dental anxiety, and then I realized that a lot of these behaviors are connected with that.
Mhm.
We've all probably encountered these patients who mystify us, the angry patients, the ones who don't seem to care, the ones who refuse to be reclined in the chair, and the no-shows and irregular attenders, and as I said, those with the poor self-care. Um, I read a lot of literature on trauma-informed practice and sensitive practice, and it gave me some good insight into these patients. And a lot of these behaviors that I've listed, they are connected with dental anxiety and dental phobia, and sometimes also a history of childhood trauma. So these are the people at risk of dental phobia. It's mostly females, people who've had adverse experiences of dental care in childhood. And sometimes if their parents uh, have a dental phobia, they learn it from the parents. And also, unfortunately, children who survivors of childhood violence or sexual abuse also. And I know, I'm not sure about the US as much, but I know in Canada, students many years ago in the First Nations residential schools, they suffered non-consensual dental treatment like extractions without local anesthesia, and so they developed phobias. And also transgender individuals have suffered from discrimination in dental care, unfortunately, in healthcare situations. So there are various ways to assess dental anxiety. And my former boss, who's retired, he created this very simple visual analog scale. And it's a nice thing to include with the medical history because it opens up the dialogue. Patients are usually quite embarrassed about being nervous. They think it's a failing and they're quite ashamed of it. But if you let them know they're not alone by using a tool like this, it opens up the dialogue so you can discuss it. And the most important thing we can do is to listen to them. So there are certain survivor issues that impede attendance. If they've had a previous abuse and violation of their personal boundaries, and they feel powerless, and also, of course, they're afraid of pain. And some people, during periods of abuse, they dissociate, which means they kind of separate themselves from the situation they're in. As a coping mechanism. So when they're stressed out during a dental visit, they might seem quite as if they're just not interested in what you're saying. And also, they can ignore dental pain and delay seeking treatment. And also, they might have low self-esteem and actually feel unworthy of receiving proper care. And of course, dental visits might trigger flashbacks and an aversion to being touched. And they also feel embarrassed about being nervous and anxious. And so there's some survivor issues impeding self-care. Again, that distorted sense of self and low self-esteem means that they tend not to take good care of themselves. And when they dissociate during a stressful dental appointment, it might look as if they're apathetic, but they're really not. They're just trying to cope. So what we can do to help them is to there are 9 principles that form the umbrella of safety for these patients. And so respect is very important. Taking time with them to listen to them and form a rapport, and sharing information and sharing control, telling the patients what you're going to do and why, and also sharing control by establishing a hand signal so that they can raise their hand and stop you if they're not comfortable. And actually, there's a really fascinating thing called the dental button, which is a button that the patient can hold. It's connected to the high-speed handpiece or to the Cavitron, the ultrasonic, and they can hit that button and stop it. And a lot of them, they don't always use it, but apparently they just knowing it's there makes them feel comfortable. So also respecting boundaries. So we need to ask permission to come into their personal space, and also check with them at intervals during the appointment how they're doing and if they want us to continue, and fostering mutual learning, because we can learn from our patients also how best to manage their care. And understanding non-linear healing, this means these patients have bad days and good days. And so it will vary from day to day. And also, if we demonstrate awareness and knowledge of interpersonal violence by having literature in our office, brochures, then they know they're not alone. And then that makes them also feel better. So we know the physiological effects of dental anxiety. It causes that acute stress response, the fight or flight, increases your cortisol and norepinephrine and raises the blood pressure. So this means that also they're more likely to have a medical emergency. It could precipitate a medical emergency. So this is why it's so important to manage that anxiety.
Mm-hmm.
So the extreme dental anxiety raises your ASA classification. So what can we do to help them? There are various techniques you can use. There's self-hypnosis and guided imagery, and also they can have headphones connected to the TV or relaxing music. And you can also get relaxation apps on your smartphone, such as breathing apps, deep breathing and relaxation techniques. And here's an interesting thing. A weighted blanket. You've probably heard of weighted blankets for insomnia and anxiety. So this Canadian company developed a weighted blanket you can use in the dental office, and it acts on your limbic system, which is your emotional brain, and it reduces cortisol, and it activates the parasympathetic nervous system, which is the parasympathetic is the rest and digest part of your central nervous system. So, and this one, it can be disinfected also, so, which is so important, especially nowadays.
Oh, yes, absolutely.
So the formula for the weighted blanket is usually you get one that's about 10% of your body weight. That's how you select it. And there are various modes of pain management. People with dental anxiety or severe phobia, they tend not to want injections, and also they usually don't like sedation because they like to know what's going on, even though they're terrified. So there are other ways of managing it. And so there's virtual reality, there's non-injectable local anesthesia, or you can apply desensitizing paste like MI paste before you do your prophy or your scaling. And then these last three are types of they're apparatus for administering local anesthesia, but they have a sort of vibration thing, so which apparently it distracts from the pain stimuli. So those make for more less painful injections. So the virtual reality is really interesting. In order to perceive pain, you have to be paying attention to it. So if your nervous system is distracted by being immersed in this virtual environment, then you feel less pain. And it's actually been very successful. The virtual reality has been shown to be as effective as nitrous oxide, and it can reduce pain by 52% and reduces anxiety by about 60%.
Wow.
And of course, there's all the little things that show patients that we care and make them feel good. Put little Vaseline or lip conditioner on their lips. It's such a small thing, but it's huge to them that we care enough to make them comfortable. Of course, sharp hand instruments, especially now we're limited as to our our aerosol generating procedures. Um, some people might want a blanket that makes them feel comfortable, and of course you have to make sure that there's a fresh one for each patient if you have to use a blanket, and then various pillows and cushions. And lavender oil is interesting because this has been shown to reduce anxiety. So you can, what I usually do is I just drop a little bit on their bib, and they really like that. So when it comes to oral health counselling, although we're really well-meaning, we often couch our oral health counselling in negative terms. If they don't comply, terrible things are going to happen. So it's better to focus on the positive. And also, if they're afraid, that they tend to not act, then they're less likely to take on board our advice. So we need to focus more on listening with open-ended questions to promote dialogue, and affirmation to acknowledge their struggles, and reflection that shows them that we care, that we're listening, and also summarizing shows that we are listening. So it sounds like a lot to do in the constraints of an hygiene appointment, where we have so many other things to do, but it really pays off. And these things can be achieved in a short time with just like short interventions. You don't have to spend a lot of time on it. Just brief interventions. So we've come almost to the end, and I really love this quote. Could a greater miracle take place than for us to look through each other's eyes for an instant? And this puts empathy in a nutshell, I think. And I think that if we show empathy, then everything else will fall into place with our challenging patients. And also, I think sensitive practice should be a standard of care for all patients.
Absolutely. Wow. Thank you so much, Linda, for
It's
sharing
my
such a
pleasure.
great wealth of knowledge that you have. I think that this will be very, very helpful to a lot of people out there, especially those hygienists. Well, thank you so much, Linda, for sharing such a great wealth of knowledge that you brought to us today. I'm sure that a lot of hygienists can benefit from all of these tips that you have provided us with. Now, before we end, what kind of advice would you give to the new dental hygiene students?
I would say after you graduate is when a new learning journey begins. It's just beginning, really. And I think you just need to keep learning, and that will keep your passion. If you do what you love, everything else falls into place, and then good things will come to you because people notice that passion and they really appreciate it.
Absolutely. Well, thank you so much, Linda, for joining us today. It really was an honor to have you join us and provide us with such great amount of knowledge. And stay tuned for more to come, guys. Just stay tuned and just wait for more inspirational professionals to be joining us in our Inspirational Professional series. Take care. Bye-bye.
Thank you so much, Martha. It's such a pleasure.